Good morning. I'm Rick Young, CBS 19 News anchor, and it's my pleasure to welcome you to the American Red Cross Central Virginia chapter CBS 19 News Heroes Room. CBS 19 News is the proud official media partner of the 2021 Celebration of Heroes and every Celebration of Heroes event since it began in 2017. It is now my pleasure to introduce your American Red Cross leaders, Carolyn Devine Saint, Board Chairperson, and Bill Brent, Executive Director.
Good morning. My name is Bill Brent. I have the honor of serving as Executive Director of your American Red Cross Central Virginia chapter. It is a privilege to work with heroes every day, the staff and volunteers who support the Red Cross mission to alleviate human suffering in the face of emergencies. Together, today we come together to honor our community heroes who also, through their actions, alleviate suffering and lift others. Claire Barton, founder of the National American Red Cross, once said, "I have almost complete disregard for precedent and a faith in the possibility of something better." It is now my heartfelt pleasure to introduce one of my heroes, someone who always has faith in the possibility of something better, Carolyn Devine Saint, Chairwoman, American Red Cross Central Virginia Chapter Board of Directors.
Thank you, Bill. Good morning to our 2021 heroes and special guests. It's hard to believe that just over a year ago, we had to cancel the 2020 Celebration of Heroes as COVID-19 restrictions went into place. We have needed our exceptional heroes this year as we face new and uncertain challenges. Clara Barton also said, "You must never so much think as whether you like it or not, whether it is bearable or not. You must never think of anything except the need and how to meet it." Today, we are here to celebrate the acts of selfless individuals who saw a need and figured out how to meet it. We're here to show public recognition and appreciation to these brave and caring people who have demonstrated extraordinary courage and inner strength. They reinforce our faith in the good people around us.
Through their tenacity, perseverance, and generosity of our community, the American Red Cross mission is alive and well. But the way we carry out that mission has certainly changed. Today's event also raises funds to support the American Red Cross mission. The American Red Cross mission prevents and alleviates human suffering in the face of emergencies by mobilizing the power of volunteers and generosity of donors. This is a powerful mission statement. Red Cross volunteers are there when family has lost their home to a fire, when a military member and their families are in need, when a hurricane strikes and leaves many without a home, when there's a patient in need of blood. Red Cross blood donors provide for that need. In the last year, your American Red Cross Central Virginia chapter has provided over $82,000 in direct financial assistance to 478 individuals following disasters. We've collected more than 19,000 life-saving units of blood that are there to help more than 57,000 patients. And we trained over 5,000 community residents in first aid, CPR, AED, and other life-saving programs.
Those are impressive numbers, Bill, but none of that would be possible without the commitment of nearly 300 area Red Cross volunteer heroes who answer the call at a moment's notice in our communities, our state, our country, and around the world. Last year, our local volunteers collectively worked more than 14,000 hours, which translates to a dollar value of $400,000. And did you know 90% of Red Crossers are volunteers? We recognize our volunteers as heroes because without them, we would not exist.
And now we'd like to thank our corporate sponsors for their support of this year's Celebration of Heroes. Our good friends and media partner, CBS 19 News, Charlottesville News First, presenting sponsor and welcome Carter Bank and Trust, Northrop Grumman Mission Systems, Charlottesville Plant, Woodard Properties, R.E. Lee Companies, Paul Davis Restoration of Central Virginia. All of those sponsors have been with us since 2017, and we also welcome First National Bank as a new sponsor this year. I'd also like to give recognition and thanks to our special National Red Cross Annual Disaster Give Program donors. And we're fortunate enough here in our community to have board representation from State Farm Insurance, Northrop Grumman, and Michelin. They make a huge impact here at home as well as nationally.
We're here today to honor some very special people for their service to others. They have lifted our communities. They've shined lights of hope into the lives of many others. In the words of Marion Wright Edelman, service to others is the rent we pay to be alive. It is the very purpose of life, and not something we do in our spare time or after we've reached our personal goals. It is up to us, it is up to me. We are truly fortunate to have many people in our communities who, without thought of what they will gain, jump in and get involved. The humility to not want praise, but the confidence to accept it graciously. That's what makes a hero. The person who impacts a life without the afterthought of, what do I have to gain? They put others first, rolled up their sleeves and got involved. You'll hear their stories. You'll witness the difference they made. They inspired us, and they're going to touch your hearts too. So let's get started.
Yes, Carolyn, let's get started. It is now my pleasure to introduce Michael Corrigan, Northrop Grumman Mission Systems, Charlottesville Site Director, to introduce our 2021 Military Hero.
Good morning, and thank you, Bill. The Military Hero is presented to George Stevens. George will have worked at Northrop Grumman 43 years this coming June. During his nearly 43 years of service, George has worked on numerous proposals and programs supporting the United States Navy and Coast Guard, as well as many international navies. In addition to his work at Northrop Grumman, George has served in the fire and EMS realm for 40 years. This service includes the role of fire chief at the North Garden Volunteer Fire Company for 20 years. George is a valued member of our Northrop Grumman family and the local community. Congratulations, and thank you for your service supporting our military and our community. The American Red Cross Central Virginia Chapter 2021 Military Hero, George Stevens.
And our congratulations to our military hero, that is George Stevens. George, thanks for joining us.
I'm glad to be here.
First of all, you've been in service in many ways to our country, to our community, at your job at Northrop Grumman. What keeps driving you?
Well, I enjoy being able to serve our fellow soldiers, sailors around the world, continuing to serve the community and the fire service as I do, but being there at Northrop Grumman, being able to provide those services that's needed to our sailors and soldiers around the world.
What do you say to people nowadays who probably don't have your background, but they say, look, there's a lot happening in our country, we have a lot of challenges. What's your advice to them?
My advice is to be able to give back to the community. Do those things that you have the skills and the talents to do, and help your neighbor, help your community. Step up and be a part.
Well, many people might say, you know, I may not, that may not be lucrative enough for me. I want to be able to be in a situation where I can, you know, make the money. But you chose, in a sense, a way to not only work for your country and your community, but also to serve it.
Yes, but I find it very satisfying to me to be able to give back to my community in that way. A simple thank you, or knowing that I did something that helped someone else in the community. I find that very satisfying to do that and to be able to help. And I would think others that once they do that and they get that thank you would be very satisfying to them as well.
Well, George, just briefly, is that the way to bring community together, to build better communities?
Oh, absolutely. Working in the community, being a part, working with our brothers and sisters in the community, that unifies us all, no matter where we are, whatever our background may be, whether we're rich or not rich or poor, whatever our race, our religion, when we work together as a common cause, that brings us together to help the community and lift us up. And when we help our community, we help our country.
Well, that's great to hear. Again, thanks, George, and congratulations.
Thank you very much, Rick.
Congratulations, George. Thank you, Michael Corrigan and Northrop Grumman, working together, supporting our community. It's now my pleasure to introduce American Red Cross board member, Natasha Gray. Natasha is the Diversity, Equity, and Inclusion Manager with S&P Global and serves as chairperson of the Central Virginia Diversity and Inclusion Committee and is leading the Central Virginia chapter's Diverse Blood Donor Sickle Cell Initiative. Welcome, Natasha.
Thank you guys so much for having me. It's my pleasure to serve as the 2021 American Red Cross Central Virginia chapter chairperson of the Diversity and Inclusion Committee, and also to lead our Diverse Blood Donor Sickle Cell Initiative. I'm not sure if you guys know, but 1 in 365 African American babies are born with sickle cell disease. It is the Red Cross's goal to fill the sickle cell gap. Our healthcare heroes are vital every day to so many. It is now my pleasure to introduce our 2021 healthcare heroes. I think we can all agree there has been no more important heroes this year than our valued healthcare workers. For that reason, we are honoring 5 special healthcare heroes this year. Our first healthcare hero, Sarah Borquist, was named for the 2020 Nurse Hero Award for an amazing heroic act, which you will learn about briefly. Because we weren't able to honor Sarah at our 2020 event, we wanted to revisit her nomination and learn that Sarah is a hero every day to more than 900 patients in her role as HIV/AIDS care coordinator with the University of Virginia Health System. Meet our first 2021 healthcare hero, Sarah Borquist.
Well, Sarah, congratulations on your award. And I just have to say that you were at the right time and the right place to really help a young mother go through an amazing experience. Tell us about it.
I was walking home from work. It's about a mile walk for me. And at rush hour, there's a whole lot of traffic, people trying to get to the hospital and around the hospital. And there was a very long line of cars stopped at a red light. But that's normal for that time of day. And a woman flagged me down. She was sitting on the passenger side of the car, and she rolled down her window and waved me to her, and she was upset. And I went up to her, and she was holding a baby on her chest, which is, that's very unusual. And I said, "What's going on?" And she said, I just had him. And it took me a second to process that, but she said, "I just had him in the car." And there was a red light. There was nowhere they could go. There was a lot of cars in front of them and to the side of them. They were very close to the hospital, but not with the cars in front of them. So I just instinctively kind of scooped that baby up just a little bit off her chest and started rubbing his feet and talking to him. I said, "Hi, baby. Hi, can you start crying for us?" And he did. He started crying and he started turning pink. And I said, "He's going to be okay. He's going to be just fine. You did such a great job." And we got him on her chest, skin to skin. And we found a coat, I think it was a coat, something to put over him. And the light turned green. And I said, "You know where the emergency room is, right?" And they said, "Oh, we know where it is." And they drove off to the emergency room. So it was, I thought about it later, maybe a 45-second interaction. And they drove away and I started shaking. I couldn't believe what just happened. I've never had anything like that happen. I've been a nurse for 15 years and I've never had a experience like that. It was beautiful. And I'm so grateful. I'm so grateful it happened.
Well, Sarah, congratulations and good luck.
Good morning. My name is Litz Van Dyke, CEO of Carter Bank and Trust. On behalf of our over 750 teammates, I just want to say how proud we are to be a first-time presenting sponsor of the 2021 Help Can't Wait Celebration of Heroes event. It is my honor to introduce three of this morning's remarkable 2021 Central Virginia Healthcare Heroes. Each of these healthcare heroes are University of Virginia Health Systems ICU nurses. Given the events of the past year, I can think of no more appropriate area than the ICU to find heroes. Their work is compelling every day, but each of these stories we're about to hear and share exemplifies what it means to go above and beyond the call of duty. It is my pleasure to introduce the next three 2021 American Red Cross Healthcare Heroes, Charlotte Lineberry, Drew Shiflett, and Jacob McQuiggan.
Another healthcare hero that we're honoring is Charlotte Lineberry. She's a registered nurse. And Charlotte, thanks for joining us.
Thank you so much for having me.
First of all, you're being honored for the Honor Walk, and I'm not familiar with that, but please tell our viewers what the Honor Walk is and what it's for.
Okay. So an honor walk is something that the hospital does to honor patients who are going to be organ donors. So people who have been or will be soon declared dead. And it's a way for the hospital and all the workers and families to honor all of the work that went into caring for these patients, the lives of these patients, and the sacrifice that they are about to make.
This must be very emotional for you.
It's something that definitely ties up a lot of emotions because you're not only respecting the life of this patient, but also the chance for life that they are giving to somebody else or several somebody else's.
So again, it's a matter of you organizing the Honor Walk where all the medical professionals honor this one individual who's actually giving life to possibly 5 or 6 people.
Mm-hmm. Yep.
Well, again, congratulations on your award, and we thank you for your work.
Thank you so much.
Our next honoree is Drew Shiflett. She's a registered nurse. Drew, thanks for joining us.
Yeah, thank you.
One of the reasons why you were nominated and you won is because you did something really extraordinary for at least one family that we know of, where you actually arranged pretty much heaven and earth to make sure that the person who was passing, apparently from COVID, they had a chance to interact with their family. Briefly tell us how you did that.
I had a really long journey with this patient. I actually knew, a lot about their family and a lot about the patient through talking with the patient's daughter and the rest of his family, his wife and everything. So I kind of felt like I knew this patient by the time he had passed because I'd taken care of him so much and learned so much about him. So it was really, hard for me to see him pass and hard for me to see his family grieve. So I wanted to make this, as special as it could be.
But let me just say one thing here. You also arranged people outside of his room to make sure that he could wave to them, correct?
Yeah, he wasn't actually able to wave to them, but I wanted to make sure they could see him just due to the visitor restrictions. We could only have 2 members of his family come in.
Right.
So I was able to get him facing the window before he passed, and then the rest of his family on top of the garage, the parking garage, which was level with his window, so they could actually see into his room.
Right. Well, that's an extraordinary story, and I wish we had more time to talk about it, but we do thank you for your dedication, Drew, to getting people through this incredible pandemic, this epidemic, and we also applaud you for being a healthcare hero. Thanks again.
Oh, thank you.
Thank you. And another hero we're talking to is Jacob McQuiggan. He's a registered nurse. And Jacob, congratulations.
Thank you. Appreciate it.
Well, this is obviously a high honor for you, but it's also because people recognize you've gone above and beyond, especially in certain circumstances with a COVID patient. Tell us about that.
It was a patient that was going to imminently pass. So I did the best I could to get the family there. The difficult issue with that was that the son was part of the Navy and was stationed in Charleston, South Carolina, and they were unable to give him the leave required to come see his mother. So I spoke with the American Red Cross to get him the leave that he needed. They just needed to speak to someone from, the medical field, to prove that it was actually legitimate. And he was able to get his leave and come see his mother before she passed.
Well, obviously, this is a tough time for all of us, but especially for all of you medical care workers, you professionals in this field. It's got to be really tough. But does your job description say that you actually go beyond and try to get family together? It's not your job description.
No, I mean, family-centered care is a part of everything that we do. Our job description is very loose, I feel like, in that situation, and it's all on whatever the situation, calls for.
Was this the only time you had to do this, or the other times you pretty much had to bring families together in this medical crisis?
We are doing it, honestly, every day at UVA in the COVID ICU, as well as our regular medical ICU. We are having to kind of think of different ways on how we can involve family, whether that be Skype, FaceTime. We've done some really interesting things to try to get as many people involved in this type of care, especially when it comes to withdrawal of life supportive measures and end of life.
Well, Jacob, I know all of you and your medical professionals have a tough job. We certainly appreciate it, and congratulations on your award.
Thank you so much.
Thank you so much. And again, congratulations to Charlotte, Drew, and Jacob. Also, thank you and welcome to Litz and the Carter Bank and Trust family. We appreciate your support and the partnership with the American Red Cross. As Jacob mentioned in his story, the American Red Cross played a part of that. The American Red Cross provided emergency communications between our soldiers in uniform and their families since the founding by Claire Barton 140 years ago. Our final Healthcare Hero Award is being presented to Scipion Lewis. Scipion is a long-term healthcare provider, single mother and grandmother, COVID-19 survivor. Her story is one of resilience and determination.
So, Scipion, thanks for joining us, and congratulations on your Healthcare Hero Award.
Thank you.
Now, to my understanding, you were working 90 plus hours a week at a nursing home and you caught COVID. Tell us about that.
That is correct. I was working 90 plus hours a week. I caught COVID and it took me out of work for 3 months.
What kind of symptoms, if you don't mind my asking, did you have? Were they severe? Were they mild?
They were severe. The loss of taste, smell, the oxygen loss, body aches, the diarrhea, the vomiting, high temperature. I had them all. I also caught pneumonia.
I'm sorry to hear all that. But you did work, you are working, you're back working in a nursing home again, so you're back in the front lines.
Yes, I am.
And how's it going?
It's going great. It's always a challenge, but I will remain positive.
Well, overall, again, I understand you're a very hardworking mom. You put in so many hours, and you're back at work doing the very dangerous work that you do as a health professional. We thank you for your time, and congratulations on your award.
Thank you so much.
Thank you.
Congratulations, Scipion. Congratulations to all of our healthcare workers, and thank you, Natasha Gray, for helping introduce them, and to Litz. We are pleased to have Dr. Craig Cant, Executive Vice President, Health Affairs at the University of Virginia and CEO of UVA Health, as well as many others from UVA to help celebrate and honor all of our heroes this morning, but especially the UVA heroes being recognized today. Even before there was a celebration of heroes, there was the Red and White Affair and our good friends, Chris and Arlene Lee. Today, the legacy of that early partnership lives on in our final Hero Award presentation. It is now my pleasure to introduce to you the 2021 Help Can't Wait Celebration of Heroes Christopher E. Lee Humanitarian Spirit Hero Award presenter, my friend Arlene Lee, Principal R.E. Lee Companies.
Good morning. Winston Churchill said, Winston Churchill said, a leader is best when people barely know he exists. When his work is done, his aim fulfilled, they will say, we did it ourselves. This is just how Chris Lee lived his life, by planting seeds he would never reap and continually lifting others up. He was a quiet thought leader that at just the right moment would ask a question that would change the entire outcome, qualities that we so badly need in this world. Throughout the darkness of this past year, shone the light from those who stepped up and provided a thread of stability, and were not just thought leaders, but action leaders. Individuals that continue to lead and serve and sacrifice because it was the right thing to do. They led with hope when we all needed that hope. Chris Lee was someone who led with hope. He was a light that provided stability for so many and poured himself out in the service of others. By combining intentionality, thoughtful reflection, and servant action, he planted seeds that continue to grow. This year, we would like to shine a light on an individual who espouses all of these qualities and whose work here in Charlottesville and in the world has had an impact beyond measure. And we would be lucky to learn from his example. I am humbled to present the Christopher E. Lee Humanitarian Spirit Award to Dr. Christopher P. Holsteg. Congratulations, Dr. Holsteg.
Our next awardee is Dr. Christopher Holsteg. He is the Professor of Emergency Medicine and Pediatrics at UVA. Doctor, congratulations.
Thank you.
First of all, I always think of doctors who, and you take the oath to do no harm, so when I hear a doctor gets a humanitarian award, you must be going above and beyond to get that.
We have a great team that works in the toxicology realm and in the poison center, and we're really working with those who are at risk, right? Our substance abusing population, those who are suicidal and take substances, and young kids, toddlers who get into substances, to make sure that they have a confidential resource where families, the individuals can call to get help, and we can help to guide them. Do they need to go to the hospital? Do they stay at home? What can we do for their care? And we work with many hospitals in the area, 48 to be exact, to help manage cases of poisonings throughout the state.
So, Doctor, have you noticed an increase in this kind of activity with poisons and toxic substances during this pandemic?
We have, and there's been a change. Young kids, toddlers at home more. There's dangers in the home. We're seeing more hand cleaners that contain alcohol and other substances. We're also seeing people take substances to try and prevent COVID, which are not founded on science, but also dangerous to take.
Well, Doctor, among your other titles, of course, is that you're director of the Blue Ridge Poison Center. Now, when you take in a call from someone who says, I might have ingested something, what's the protocol you use to make sure that this person hasn't ingested something that's really harmful?
Yeah, we have a number of guidelines that we follow that have been well vetted nationally. We have nurses who answer the phones who are all certified in regards to poison care. And then the team that I lead, there's 6 boarded medical toxicologists, physicians, who help to work with those nurses when cases become complex. so challenging. We have household products, we have industrial products, we have environmental. There's a number of things that we need to know, and the team has done a great job in regards to our community to give them a kind of confidential and free resource to be able to reach out to.
So, Doctor, when you take a look at the amount of toxic things coming out into this country, into our community, what are we talking about?
It's challenging. The internet has really opened Pandora's box. We used to have a lot of governmental restrictions on bringing in certain substances. That includes chemicals and rat poisons, drugs of abuse. There's a whole host of things that are entering society now that before did not. And that's partly because of the internet and people are buying them. And it's been challenging in getting the education out to be careful of these substances. There's a lot of false information right now that these substances may help for really non-scientific reasons. So a lot of public education, but also a lot of professional education with our providers on how to manage these complex poisonings that are coming in to the hospitals right now.
And you mentioned the internet, and of course, there's a problem with toxic chemicals under different names coming in from other countries, so many times counterfeit products. How do we combat that?
It's challenging, and part of it is working with our state colleagues, important partnership with the Virginia Department of Health as we look at testing when these products arise or when we see problems. Also in getting the public service announcements out. But you're absolutely right. There's new chemicals that are coming out and substances that are challenging for us, both at the university, for the community hospitals, and for the state as we look at what exactly is in these products when they're being consumed by our public.
So what's your advice to other parents or anyone who's using the internet and is searching around for possibly pills or what they feel is an antidote of some kind? What's your advice about ordering online?
I'd be very careful. I'd make sure that they're valid sites. I would look at entities such as the CDC and their recommendations as we're talking about COVID on what works and what does not work. You really need to look at what is being promoted and what is scientifically based. And being very careful on some of the false claims that are out there on other sites that are more nefarious and just want people's money.
All right, Dr. Christopher Holsteg, winner of the Christopher E. Lee Humanitarian Spirit Award. Thanks for joining us, and again, congratulations.
Thank you.
Congratulations, and thank you to all of our amazing heroes who were honored this morning. The stories you heard this morning and the people who represent those stories all embody the values and principles of your American Red Cross.
The American Red Cross depends on the generosity of the American public to support our mission. So don't forget, emergencies don't take a break and help can't wait. We hope you feel led to help support that mission, and we encourage you to do so by texting Red Cross VA to 76278, which is in the chat. You can also donate by scanning the QR code you see on the bottom of your screen. Open your camera on a smartphone, hold your device over the QR code so that it's clearly visible within your screen, then tap the banner that appears to access our donation options. Or you can donate by visiting redcross.org/helpcan'twait, or to make a pledge or receive an invoice, vadevelopment@redcross.org.
I hope today that you're reminded there is great power in the gift of who we are, and there's always an opportunity to be a hero to someone. And it's my hope that you not only have a chance to be a hero, but are also given the opportunity to be touched and helped by one as well. Remember, it is the power in me that I can do to make a difference.
Thank you, everyone, for spending your morning with us, celebrating our heroes and supporting your American Red Cross.